So essentially what I want to talk about today really is stress. So stress is something that's in everyone's lives all the time. We hear stress all about stress all the time. What I want people to understand is there's two types of stress. There's good stress and there's bad stress. So good stress is something we do need. It provides motivation. It's what actually gets things accomplished. Bad stress is, self-defeating. It can injure our health. It can affect your behavior. So really what life is about a balance between these two. So stress comes from a variety of sources, primarily two. We have environmental stress, we have internal stress. So environmental stress is things that's going on around the individual. External stress, so that could be environmental, it could be psychological, in terms of pressure from social groups near you. It could also be social. You have internal stress, or it could be illness, it could be internal discomfort. I think everyone knows what you feel like after you eat Thanksgiving dinner. That's an example of stress, because you've had too much to eat in too short a period of time. You can also have emotional stress, anxiety, stronger emotions like fear and anger. What I want to speak to today is an understanding that we all know that we're under stress. I'd like people also to understand that your animals, no matter what they are also under stress at all times. Again, their whole life, like ours, revolves around minimizing stress. So essentially what behavior is the animal in some fashion trying to mitigate feelings of discomfort and bring themselves back to a place where they feel more comfortable. What do signs of stress look like in dogs? We all probably recognize the high levels of stress. If you've got a dog who's growling at you, who is snapping at you, we realize that that's probably stress. But what I find most people don't recognize are the very early signs of stress. Those that are lower on the chart. Again, these are signals that the dog is saying, I'm uncomfortable in the moment. I would like some space to happen. And so some very early signs of stress that almost everybody overlooks is the dog turning their head away from something. You may see a lip lick, where you're going to see the tongue come out, do a little flick. You may see a paw lift, you'll see the eyes averted, you might see the body turning away. A little higher level, you might see the dog doing the, if I don't look there, it's not there. We've all seen that one. If I don't look over there, it's not happening. So essentially, again, animals are under stress just like we are. And so when we're in a situation where a shelter has to open, I'd like everybody just to have the basic understanding that anybody who's coming there, I don't care if you've got 2 legs or 4 legs, or you've got fins or feathers or whatever you've got, you're going to be under a different level of stress than you would be at home. So when the animals are coming into the shelter system, there's some sort of event going on externally that requires the shelter to be open. What's going to happen is their whole routines are going to be out of order. They're going to be put into conditions that they generally haven't been in before. It's going to be coming to the shelter system. Your dog is going to be in a crate, or your cat's going to be in a crate, or your other animals are going to be in some sort of containment. Again, we're looking at household companion animals, so don't imagine we're going to be stuffing a mini horse in a big dog crate. So your dog is going to, at minimum, if you're coming into a shelter system, I ask people, if you haven't taught your dog to be comfortable about being crated, it's a good project to work on in the winter. You want a dog who can crate up easily, a dog who can tolerate being in a crate for prolonged periods of time, as well as a dog who can tolerate being in a crate when you're not there. Because if you have a dog who comes in who hasn't been crated before, and they get put in a crate, their stress level, which already is running here, is going to go way up over the top. So the whole goal here is we want to mitigate stress, and we want to try and make things as comfortable as possible for individuals coming in. One of the things we're going to try and do today a little bit is showing some defensive handling when you're bringing your animals in. So when you're traveling around the shelter system with your dog, for instance, they're going to be in the crate and being taken out to potty areas. There are some leash tactics you can use that will minimize stress, because what you'll be doing is trying to maximize distance between approaching people, other approaching dogs. It's not about walking with your leash here and the dog out over there. It's about the dog staying meaningfully close. So the early signs of stress that I've mentioned before, a lot of times you'll see the dog avoiding touch. So Your dog may be perfectly happy in normal circumstances. Someone goes like, "Oh, hi, how you doing, dog?" And petting them, and the dog goes, "Yeah, that's sort of okay." But in a situation where they're already under a little bit of pressure, their whole routine has been switched around, there's odd sounds, the people around them are acting a little different than normal. A dog who normally might be very socially affinitive towards people or be more socially tolerant towards a lot of people may suddenly start going like, "No, I don't think I like this idea." So understand that, again, animals coming into shelter are going to be under stress. So it's, the big thing here is give them space. Give them some time, give them some space, certainly let them calm down. Some breeds of dogs are going to have a lower tolerance for invasive handling, pressure in their space, events going on around them than other breeds. One of the reasons that you often hear Golden Retrievers and Labrador Retrievers make a great family dog. They have a high degree of tolerance towards what they consider inappropriate handling before they go up to the top of that chart. When you get into the herding group or you get into the working group types dog, particularly guardian type breeds, their tolerance for what the dog considers invasive or inappropriate handling is likely to be a whole lot shorter, which means you're going to get a lot less possible warning time before they tell you you're being inappropriate. And understand that shaking, again, we have good stress, we have bad stress. You can have shaking happening not when the dog's having bad stress. You can have under a high degree of stress, even good stress, you're going to get trembling. One of the things that happens as you start to go up this ladder of intensity and behavior is you're going to start to see something that I look for very carefully is what I call range of behavior. So at the lower levels of stress, there's a lot less pressure on the individual. You're going to have more behavior happening. You're going to have more movement. That movement is probably going to be somewhat jerky, but it's still going to be a lot of it. You're going to see feet sliding around, ears moving, eyes moving, nose twitching, increased respiration. You're going to see, when you start looking at it, a lot more movement. It's basically fidgeting. This is the first level of stress, is fidgeting. So you're going to see a lot of movement in these lower levels up to what I call walking away. If you have eye contact, or if there's eye contact with whatever is the stressor at that point, it's going to be, yeah, I saw that, and a pretty quick step away. So I look for range of motion, how much behavior am I seeing? I also look for length of eye contact. When I get up into the next level, which is creeping, ears laid back on head, standing, crouched, tail tucked under body, the range of motion starts to slow. I'm starting to see fewer numbers of behaviors. The animal's starting to get a little stiffer. Their behavioral range is getting smaller. You're also going to start now to see a little bit longer pronounced stare before they break eye contact. And it's going to be different because essentially, if it looked, it's sort of like, yeah, what's that? So it's going to be, the animal's going to be pretty much in some constant motion. It's going to look pretty smooth. As they start to get more stressed, they're going to spend longer time looking at stuff. And you might see a faster turn away from it. As you come up the scale, when we get down to that part, we've got lying down, rolled over on back. The range is becoming quite restricted. The stare may stick and slide away, or it might start becoming a little bit more fixed. When we get into the last two, particularly the second from the last, where we've got the stiffening, the direct stare, whale eye, freeze, these are getting into higher levels, you're going to see a very limited behavior range. The animal's going to be starting to get very, very still at this point. And believe me, still behavior is not necessarily good behavior. I'd say lack of behavior is a huge signal in and of itself. So, people say, well, the dog's on a stay. Okay, what I want to look for a dog on a stay is a dog who's lying there like this. I want to see a relaxed looking stay. I don't want to see a stay that looks like this. Because a stay that looks like this tells me a lot about how the training to get that behavior happen. When you get into that upper range where you're getting a few behaviors, you're starting to get the stiffening, the direct eye, whale eye. So whale eye essentially is a tightening of the facial muscles And what happens is the skin actually pulls back from the eyes and you start to see white around the edges. I also have what I call eye flash, which is where you get a sudden whale eye and down. You know, we don't want to punish dogs for smoke alarm behaviors, growling, whale eye, that type of stuff, because they're saying, I got a problem here, I've got a lot of pressure on me right now, and I'm really asking you to get out of my space. Problem is, if you punish those behaviors, because, gosh, I don't want that dog growling at kids, that's really bad. If you're effective in your punishment, and you can teach that dog that growling at kids is bad, the problem is what you're not dealing with is the emotional reason why the dog's gone to their library and they've pulled growling out as the behavior to use right now. So if you punish the growl, so the dog goes, oop, can't choose that behavior, bad stuff happens. What do you have now? You have a dog who sits there going like, okay. And people say, oh, what a cute dog. Can my child pet it? And you go, oh, he's not growling anymore. It must be okay. And the dog's going like, so particularly if the dog is in a situation where they can't escape, they're sitting on a chair, or they're back in the chair, they're in a corner, they're under a table, they're on a leash, and here comes that scary thing, you're going to match them. What's going to happen is they're probably not going, they might try to escape if they've still got that in their repertoire. They're more likely going to suddenly pop up to a much higher level of get out of my personal space, or is what I call, what part of no didn't you get? Which is likely to be an air snap if you're really lucky, or a non-contact bite. If the dog does choose to use his teeth, you're going to find out really, really quickly what level of bite inhibition the dog has. So dogs who bite are not bad dogs, but they are dogs who are telling you that in most cases their pressure point has been exceeded and they're giving you some degree of a warning. So ideally, with the type of work I do, if someone says my dog's bitten people, I say, okay, we need to do a little bit better management so we don't put them in that situation if it occurs. But what I want to know is, what was the bite like? Is it like, oh, well, they just tore the clothing, or they scraped, or they put just a single puncture? If they've done that multiple times, that's a much safer dog to work with. It's much more what I call rehabilitatable, because that dog is exhibiting, even under distress, the desire or still the forebrain to go, I'm going to inhibit my bite pressure. A dog who on their first bite is doing a deep, very deep bite, or a very deep tearing bite, that's a much higher category bite, usually a 3 or a 4. Those dogs are generally not, those are dangerous dogs at that point. They're generally not what I call rehabilitatable dogs. They're going to be dogs, if someone's keeping them, they are a huge liability risk. Because that dog is demonstrating with that depth of puncture they've done, the degree of bruising or the degree of tearing, is that they're not moderating their bite, they're biting down with a great deal of force. If they've only bitten once like that, that's actually a lot worse than the dog who has 7 or 8 level 1 or 2 bites on their record, because that single bite tells you that their bite to damage ratio is real high, which means if they bite again, it's probably going to be right up there. Whereas the dog who has multiple bites that are less severe, I'm not saying let your dog do that, but if they have multiple bites and they're less severe, the probability that they'll continue that is probably good. And again, not to say they won't suddenly jump up to a real high-class bite, but when we get into that final range of behaviors, we're up to the snap and the bite. The range of behaviors is extremely few. The dog is really rigid at that point. You've got extremely locked on eye contact. So one important thing, whatever you do in life, is know your limitations, and also learn when you say, no, this is not something I'm doing. As you go up this chart of stress, the range of behaviors get fewer and fewer, the dog's body language gets stiffer and stiffer. So one of the things I do want to say about stress is the perception of stress is an individualistic thing. So what I might consider stressful, you might not consider stressful. Perception of stress is a very individualistic thing. What might be stressful for one individual might not even bother another. So the big thing is when you're in situations like this, where you're under a great deal of stress, the best thing you can do is try to figure out how can I mitigate that stress, how can I make it less. So for the animals in question, what we try to do with that is we try to maximize space. Whether or not we can, if we've got crates set up, we can have those crates far enough apart, we will tarp them or put some shelter, a visual barrier over them to make them so it makes space actually happen. You can't see stuff; it's a lot further away. You can run we call white noise generators. Might be radios, might be cassette players, but it's going to be something where the sound level is going to fill up some ambient silence to help bring some calm stuff down. Other things is leaving articles of clothing that the owner has worn in the crate with the animal. If you've got a dog who's not a shredder, they might be a shredder and they're super stressed. So essentially what we want to try and do is lower the stress so that your animals can get through the situation better, as well as you as well.
The further things inside the shelter that we're going to do to bring down stress, which is the first and most wonderful one is separation. If we have a tiny, tiny shelter, 6 people in total, only 2 of them have dogs, we're in the Oak Bluff School or any facility that has extra rooms, guess what? You can be assigned to a room with your dog, the crate has to be there, but you can stay with your dog. If I am separated from my dog and I'm worried that she doesn't feel good, I'm going to be stressed. So I've always said, I could sleep in the crate with the dog, or if my car is still intact and I have enough down blankets, guess where we're both going to stay most of the time. So that's separation into a different room. We will obviously do our very best to have cats and dogs in different rooms and cats and birds in different rooms because those stressors communicate across, even without visual, they communicate among the animals. And if we have dog-aggressive dogs or barkers who just can't stop barking, it's ideal if we can get them away from the larger numbers of dogs. And we will work with our situation as best we have it. In a really huge disaster, guess what? It's all about staying alive, and it's not a spa. So we're going to have to make do with whatever conditions we have to keep animals alive. The dogs will be in and out of their dog room on a circular path. Dogs have to go out to pee, right? So you have to get them out this way and come back that way. What you want to avoid is dogs passing each other face to face, because face to face is not the ideal way to meet another dog. So also we will have a strict schedule with nap time. Think back to kindergarten. Nap time, quiet time, nobody in the room. Just really quiet. And to the extent that you can, as an owner who's in the shelter, keep to your dog's regular schedule. Ideally, you can take them to where they always walk, and just keep that regular schedule going for them, because routine gives them assurance that everything's going to be okay. So that's it on our shelter thinking so far. And now we're going to move into the hands-on part with Betsy Buck is going to lead us off.
One thing before Karen starts is that as a veterinarian, when I have a patient come in the room, the first thing I do is talk to the owner and let the animal check out the room and check me out, and don't immediately reach out to the animal. I mean, it'd be nice for me to reach out and pet my patients, but every animal coming into the veterinary clinic, just like animals coming into the shelter, they're stressed out. And it gives the animal a chance to sort of calm down a little bit and figure that I'm not going to, turn into a tiger and eat them. And also, it gives me a chance to watch how the animal's behaving, to give me an idea of whether this is an animal I can approach directly or how we're going to handle this situation. So I would normally do what I'm doing right now, which is that I'm pretty much ignoring her, so that she can check me out and she can check out the corner here. And I'm not taking her away from her owner,
So essentially what we're doing is we're allowing the dog to acclimate to the area. So again, dogs don't, read handouts and stuff. So she's taking in information, through her nose, through her ears, through her eyes, the tactile sensation of the flooring of her feet. And she's just simply checking stuff out and giving the dogs the ability to have a certain degree of freedom to check things out is going to help lower stress. Because again, they want to figure out what's going on. They want to make sure they feel safe. So when I'm working with dogs who have reactivity issues or aggressive issues, one of the first things I do is the same as Betsy does. I just stand there and I ask the owner, I want you just to move around with your dog in this space. If it's a dog that has space issues with people, I ask them, don't allow your dog to come up into my space. But just allow your dog to walk around as much as you can on this leash. And particularly what I ask the owner to do or not to do is don't ask your dog to do something, i.e., if the dog starts looking at me, getting stiff and growling, don't tell them no, don't tell them sit, don't tell them do anything else. Just manage the space. If you need more space to move out, go and do that. But give the dog the freedom to move around choice, because freedom of choice of behavior is going to lower stress dramatically. The more you limit choice in stressful situations, sometimes the more stress you can put on stuff. We do obviously need a certain degree of environmental control. So when your dogs are coming into the shelter system, we ask people not to walk your dog on the very end of its leash. So if you're coming in here, so what you want to think about is in terms of leash length, think about that as opportunity. The dog has more opportunity to get into things. We do want to give them a somewhat of a shortened leash, and when I say shortened leash, I mean something that's got to be something along the lines of this. You've got about maybe 30 inches of leash. You're going to keep your hands pretty tight to your body. The dog has some freedom to move around here. Situations arise, so you've got to pass by people. You can just slide your hand up, lock it, and now the leash is a lot shorter. The dog can still move around. But
Yeah, and you can ask the owner, among other things, like how is the dog normally at the vet clinic? Because sometimes owners aren't forthcoming, or they think that because their dog acts, say, unusually nasty at the vet clinic, but is nice in all other situations, that might be the dog's reaction to stress. And so if you ask them, well, how is this dog normally handling, when the veterinarian does an exam or a technician gives the dog a hug, how does the dog react? The other thing that I do when they first come in and they're stressed out is, Karen was talking about the hard stare. Well, you can give that to animals, and you can do it unintentionally. They can take you looking at them.
That's what primates do.
And so if I have a patient coming in and I need to give them a chance to de-stress, I don't stare at them. And I may even, depending upon how nervous the dog is, if I need to look at the dog, I'll look at the dog and look away, and look at the dog and look away, and kind of make sure my face is relaxed. Now if these dogs, when they come in, there's going to be paperwork that the owners are going to be filling out. They fill out paperwork for themselves coming into the emergency shelter. They're also going to fill out paperwork for their pets. They're going to check in two different places. They're going to bring their animals in after they get themselves checked in. They'll bring their animals in and they'll get checked in with us. And as a veterinarian volunteering to be there, I need to check out these animals and make sure they're okay to go into the shelter. And I'm going to have an assistant with me, because I can't examine a dog or a cat with nobody helping me out. In some cases, the owner can help me, but I don't always let the owner help me. Owners aren't necessarily trained. They may not know what they're doing. They may be overconfident about their dog's behavior, which isn't very helpful. And one of the things when we were having a dry run over here with the shelter, one of the things I realized is that I have volunteers that don't know how to just basically hold animals for an exam. And I can tell looking at her, she's a real sweetheart, and she's going to let me do this. And it's one of the things that you as a volunteer need to learn to recognize their body language to decide whether this is a dog I can approach or a cat I can approach. And as a veterinarian, I'm going to trust your instincts. Even if you're a brand new volunteer, if you look at this animal and there's something I'm not seeing and you say, I'm not comfortable with this, tell me. I'm not going to be mad if it's some human safety is going to come first. If we have to find a plan B for dealing with the animal, we will. So if you tell me that I'm not comfortable because you're seeing a look in this dog's eye or on this cat's face that I'm not picking up, you tell me, and we'll do it a little differently. And if they don't get an exam, they don't get an exam. So, but anyway, normally when I have a patient come in for an exam, after I've decided that that I'm comfortable and the animal's comfortable enough to deal with, I usually take a hold of them by their collar or near their collar, or I have a technician do that. And with dogs, if we're not putting them up on a table, get down on the floor with them. And what I'm doing right now is I've got my fist between her face and my face, so that she can't get me. Because I would rather she got me in the arm than in the face, okay? The other thing is that dogs will tend to see she's seeking comfort with her owner, and they'll do that too. And sometimes then I'll have the owner stand up again and make some space there, because if I try to pull her away from the owner, that's even more stressful. Or they'll hide between the owner's legs or behind them. I ask the owners to move them out. Don't go for one of those dogs, because then that's a cornered animal. Okay, even if you're in an open space, that animal's going to respond as though it's cornered. I'm going to ask her to stand up gently. Well, she stood up on her own, but you can kind of tap them on the tummy to ask them to stand up. And you know, dogs, some dogs like to be rubbed in the tummy, but the tummy's a sensitive area too, and they may not like it. But I'm going to put one arm around her here and one arm around her here, and that's how I would want a technician to hold her. It keeps her from sitting down when I'm putting a thermometer in her butt. It also keeps her still. It allows me to have access at least to the left side of her body, front and back. If we need to, we'll swap sides to look at the other side. The other thing that the technician is doing with this arm is I am not strangling her, but I am holding her firmly enough that if she goes to bite somebody, she can't get them. I also have a hand over the top of her neck, so if she goes for my face, hopefully she won't get me. But the idea is to keep her head under control here. But we really don't want her to be able to bite. And if you feel that you can't do this, or that you're losing control, or that there's imminent danger because you can feel her body tensing up, you can tell me.
Shake off to me is a real clear sign the dog's under some degree of pressure. It could be, I'm excited because wow, I haven't seen you all afternoon. Or it could be like, okay, I am handling what you just did. I'm not thrilled about it. So it's basically, I call it they're rebooting their emotional system. When I'm working with a dog who's under a high degree of stress, maybe it's a reactivity dog or aggression dog, or it's got high level of fear for some reason, I am very carefully watching and really keeping note of how many shake-offs I see and how frequently they're happening. I haven't seen this written down anywhere, but for me personally, if I see 3 shake-offs or more inside of 2 minutes, that dog's running under a pretty high level of stress. They're saying, I'm keeping it together, but I'm on the edge. So it tells me I need to change something in the environment. Maybe I need to move further back. Maybe I need a visual barrier. Maybe I need to change the working location. Because there's something there that's clearly disturbing the dog. I need to figure out what that is so I can bring the dog back to a state where they're like, okay, I feel better about this. And then we can proceed.
Hopefully we'll have some slip leads while we're at the shelter. I don't know if we have any slip leads.
We do.
Okay, all right. Because slip leads make this easier to do. And there's a way, I don't like to reach into cages after dogs if I can avoid it. And what I will often do, let's see if we can make a slip lead. Usually while they still have the, while they still have their collar on, I'll put a slip lead on.
I like that color.
You like that color, huh? What are you doing? What are you doing? And then we can take the collar off. So what I was going to show you with this is I've been asked if you have an aggressive dog, you put a slip lead on him. I mean, normally she's a nice dog, so I would go ahead and put her in there and pull the slip lead off. I know this dog, well, I don't know her well, but I've seen her, worked with her twice, and she's a good dog, and I know that I can pull the slip lead off. Sometimes you can't. So trying to get the slip lead off, you can actually take a leash or tie another slip lead to the slip lead here. And that'll allow you to open that loop when the dog goes in the crate, and then you can pull them both off. So, can you kennel up for me? As soon as I figure out how to get this
So
open.
here's another thing. See avoidance? He does not. Okay, Violet's saying, I recognize it's a crate. I know how to do this behavior, but it's in a new location.
Nope.
Whole different situation. It's not my crate, it's helping out
It would
dog.
help if it had some of her stuff in there. So again, like a t-shirt or something like that. Come on.
So this is another stress signal. You've got a
Yeah.
dog who's got a pretty reliable cue. You ask them to do something, they go, ah! Okay,
Oh.
now, 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 okay? You ask them to do something, they go, ah! This is not a dog being dominant. It's not a dog being stubborn. It's a dog saying, right now, I got a lot of things on my plate. This is not one of them. This is such a good idea. That's not all I want.
Aww.
We talk about the lack of behavior. There's no range of movement.
That's right.
Try to make the time so that the animal can get more comfortable with checking out the experience. Because if they're more comfortable going in, they're going to be more comfortable going in. Again,
It'll make it easier next time.
I was going to say,
instead
yeah, again, the basic law of learning science, behavior that works gets repeated. If you have to physically force the dog into the crate, you are not going to be emotionally making them any happier to go in the second time. Socialization for dogs is not your dog meeting other dogs and people. It is, I call it the world experiences store. It is sight, sound, smells, taste, textures. It is all encompassing on everything. So if you think your puppy is being well socialized by running up to say hi to every other dog, that is a tiny little page in the dog socialization thing.
You can let the dog out and slip the lead over their neck. What I usually do is make sure that there aren't any other animals around at the time in case I miss. In case the dog slips past me, then you can, but it's much safer to put that lead on the dog when the dog is not in a crate and doesn't feel cornered.
It's a really good thing to teach your dog to accept wearing a muzzle. Now, short-term muzzles are, we call them Mickey muzzles. This little sleeve muzzle slides over the dog's snoot, gets clipped behind the head. Those are for very limited duration, i.e. you're at the vet's office, your dog goes, you're like, yeah, but for longer term, if you've got a dog who has a predisposition, is a biter, you know the biter is, and in under stressful situations like let's resort to biting, teaching any dog to wear a muzzle is a good idea. I like, my muzzle of choice is called a Baskerville muzzle. I should have brought one in. It's a big rubber muzzle, and when you put them on the dog, it makes them look like Hannibal Lecter. But it's a very safe muzzle. It is also an extremely comfortable muzzle for the dog, provided you properly train it. They can eat through it, they can drink through it, they can pant, which is most important. Because this
They
is what
can vomit.
Exactly. When you go out under stress, the body temperature starts to rocket, and biochemically what happens is your body starts to say, I need to cool down the core, it's getting too hot too fast. And so panting, where you're basically exchanging moisture-laden air and the tissues that are carrying that through evaporation, allows body temperature to drop. Obviously, panting in very humid conditions is not very functional. So again, muzzles, restrictive muzzles in hot weather are very bad.
They can overheat very, very quickly. And panting, actually, when they pant, they're actually cooling off their brain.
Yeah.
Because the air is actually going through their sinuses, and there's a vascular net between their brain and their sinuses, and it cools off the blood that's going to the brain. And so that panting is very, very important.
We don't have the luxury of unlimited places to put dogs, and we're not going to put a dog that is healthy upon presentation out on the street because, oops, he didn't have his rabies and so he's not good enough for the shelter. At the same time, we will keep it in mind and take extra precautions with the dog that's unvaccinated.
So normally, if you want to read a chip on the dog, he's going to want to smell the instrument.
Yep.
You're not going to walk up to him and just go to his back with it because he would react to that. So if he can see it and he can smell it, then so we put the food away, and so he'll smell it.
So the microchip is to identify the dogs. And I'll do the same thing. Everything that they practice, I won't come right up to the dog and try and microchip it. What I'll do is if somebody's restrained a dog, they have it, this dog's been out running loose, I'll talk to the person first with the dog around me to try to get used to my voice, what's happened, and then I'll just keep the microchip reader out so that they can get used to it. And then, so where they do implant them is between the shoulder blades, but they can migrate to other parts of the body. I did get a reading.
Yours is quiet.
Yeah. So if I can't get it here, I'll go down the legs, and then I'll go down the back, and then on the back end too. And then what I do, it's a PetLink phone number that you call or look up online, and then it tells me the company that the animal's registered to. And then I call the company.
And the chip number.
And the chip number. So from the chip number, that's what I get. I tell the company what the chip number is, and hopefully the pet is registered. I'd have to
Yes,
say
that's the important thing.
50% of the time, they think they're registered and they're not registered. So then I'm back to square one of like, okay, start knocking on doors or whatever.
It's important to chip your dog or your cat or your ferret so that they get returned back to you if they get lost, and if there is some sort of emergency, say there's a hurricane and your house gets destroyed and your animal gets loose, then we need to have a way to reunite that animal with you. And these chips are now readable internationally. And so no matter where that animal winds up, that animal could be picked up by a well-meaning person who thinks, this is a feral animal, I'm gonna find a home for it in Missouri. And they take it to Missouri and a veterinarian scans it and it can be returned back to you. The other thing is that collars and tags, they lose those. They get lost, they lose them, the tags come off, whatever. It's just not as reliable as a microchip. The chips, you can get them from your veterinarian. There are some animal shelters that will chip animals for you.
I do offer in Oak Bluffs to come by and scan your animals and to just double check.
Yes.
And a lot of people are like real concerned about how to register and all that other stuff. So I'll give them everything, the chip number that's in the animal, or whether it's not in the animal and they thought there was one, and then all the contact information. And then it's just step by step of registering.
In Massachusetts, the law requires that ACOs who pick up animals scan them on admission, scan them again before they're transferred elsewhere, like if they were given to the shelter for adoption. And also veterinarians are supposed to scan new patients. So the vets have scanners. Vets also have scanners because they microchip animals, so they put the chips in and then they scan them to make sure that the chip is working and readable and everything. So
Any animal you have, or any work you do with animals, it divides into two categories. It's either management or training. Part of the reason that veterinarians do so much pushing for neutering of animals is because they have an understanding that most owners aren't going to be responsible enough to maintain an intact animal. In Europe, a lot of the animals are intact, both males and females. In this country, there's more.
So if you have good practices and you always adhere to them, then you will avoid problems with dogs that you just don't understand their history. So it's not important as much to understand history as to have great practices and adhere to them.
It's understanding, it's all behavior. There's no good behavior, there's no bad behavior. For dogs, it's all about behavior that works.
One of the most important things for our veterinary examination would be to see if the intact female is anywhere near her heat. Because if she is, then we know that the intact males that we want to take some
it'd be
precautions.
better if they were in separate rooms then.
Position of the collar is important. Okay, so like they said earlier, controlling the dog's head will help you control the animal. If it's down on the bottom of their neck, you are going to get a pulling dog, and I can't control him as well. If the collar is up behind his ears, so the first thing we do when we move a dog is to move it up behind their ears, and then we hold it like this. So once you get the dog like that, wherever I want him to go, he can go. He has to go where his head's gonna go. And he won't pull back when it's up behind his ears. If it's down on the bottom of his neck, he will pull.
There is a training that will be done by the Salvation Army on the leadership structure that is used everywhere around the country. That was basically came out of the big fires that they had to coordinate. It's called Incident Command System, and it's a very clearly structured command chain of command. And for a shelter situation, we have the overall shelter manager, etc. But in the animal part side of things, we will also have the person who is in charge of the animal management, and that person does not have other jobs. And so that command system has to be baked in from the start, and that's why we we know this is the island. We will have volunteers, but we need a very solid core of pre-trained volunteers for that command system. And the first, when if we had a huge Hurricane Sandy direct hit, we would have people coming out of the woodwork to help us, but if that solid core of leadership isn't trained, we will be facing a mess within short order. So the first message that you give to the people coming in to help is, you will report to so-and-so and so-and-so only, and you will not do things on your own decision. We need to keep the whole machinery moving.
So not to give you the warm and fuzzy, after Katrina, they created this whole, on FEMA, there's courses that you have to take, and it's called Incident Command Systems, ICS, and there's different levels of it. And not that you here don't have to take them all, but
You can
people.
take them online.
Yeah, you take them online and you get a certificate to print out. And there's certain, like, in order to have him go to disasters around the country, we had to do it. So at the end of the day, there are people on the island that have taken all of those courses. And then there are people that will volunteer that will help them. So those people will be clearly identifiable once it happens. And usually there's a written protocol, and I know for the island there is, that has all that laid out. Now, does it get into the finite about, this volunteer will do this? No, there's only the hierarchy of how it will flow. And then it's up to the individual organizations like this that will figure out how they're going to support that.
Again, you want to keep track of your personnel flow. You want to make sure that data stays concurrent, so that the last shift going off, the new shift coming in isn't starting from ground zero. So everything is, again, it's a very organized thing. Again, having been in search and rescue, coming up from doing field work as a canine handler to going up to being search manager, I tell you, the most critical part of the entire search is the first 30 minutes. Because if you don't have it organized in that period of time, you cannot keep up. You've just got information that's coming in so fast and so frequently that it just isn't sure payoff. So it means people need to have the training ahead of time, so that when you step into that situation, you already know what to do. Again, here comes stress playing in. The more knowledgeable you are, the less stress affects you. Somebody once said, never attempt a new task if you're under stress, because it's just not going to go well.
So we're going to have people bringing cats in, and optimally we'll have cages like this for the cats. And I actually have told people that if you have a cat, you should get one of these cages in case of an emergency, because it would be terrible for him to have to spend, even 2 days in this. He needs to have a litter box. In litter boxes, he needs to be able to get away from his litter box. Food, water, litter, some space to move around in. Somebody brings a cat in like this, I am going to look at the cat and sort of assess their behavior. Stressed out cat might be panting. You can often tell by the size of their pupils. Now, if you're in a dark place, their pupils are going to be really big, but if it's a well-lit place and their pupils are really big, that's adrenaline rushing through that cat's system. I'll tell you, the cat that I know is going to nail me is the cat who's plastered against the back of the cage, looking at me, and its pupils are like this big. That cat is so frightened, and what I would do with that cat, like if somebody brings a cat like that in, and I'm supposed to be doing an exam, no. That cat is gonna go, the whole crate is gonna go in here. I'm gonna set up the cage, put the crate in there, open the door of the crate, close the cage, cover this, and leave that cat alone. That cat needs some decompression time. If that cat were at the vet clinic and I absolutely had to get the cat out of the carrier, or somebody brings in a cat to us that's injured or sick or something like that, we're going to take the lid off.
Yeah.
We aren't going to be dragging the cat through the door, okay? But I will take a look at that cat quickly and decide what we're going to do with that cat. The other thing is that the cats are not to be taken out of their crates in an open area. Got to have the doors closed. Got to make sure if somebody comes through that door, we're not expecting it. Close the door. There shouldn't be any dogs out. There shouldn't be any other cats loose. No birds.
One of the biggest differences between cats and dogs is that dogs have, and I mentioned this with Goldens and Labs, they have a fairly high degree of tolerance for what they consider inappropriate invasive handling. Cats, as we all know, don't. And so,
So this is Earl, and he's, did you see him lick his lips?
notice his claws.
He's making muffins. He's a little, he's not showing us typical cat behavior because he's not a typical cat. I can tell you that his pads are sweating. So he is nervous, and he was licking his lips there. Cats will often do this, subtle looking around. And that's a sign that cat is nervous. And I don't know, it wasn't something I was taught in vet school, it's something that I've learned. I don't know if that's because when the adrenaline gets rushing, your mouth gets dry, but cats will sit there and go. And sometimes I'll have a cat that's behaving perfectly well that I'm holding like this, and the cat's going, and I know that cat isn't happy. So the other thing is that a purring cat isn't necessarily happy. Normally, if I need to do an exam on a cat, my goal is to have that cat not leave, basically, and oftentimes owners aren't so good at keeping the cat from leaving, and if I have a good assistant, that's going to be the assistant's job. The cats do, despite the fact that dogs have this reputation for having an excellent sense of smell, cats also do. What Karen's doing is perfect. I don't want this cat leaving the table. If I'm a veterinarian, I may be going over to get my stethoscope or getting the thermometer, and I don't want this cat leaving. So the goal basically is to safely keep the cat on the table. If we needed to do something more invasive with this cat, there's a few different ways to do that. Sometimes you can just hold the cat. You just gotta watch that he's not gonna suddenly decide to bite you. It's hard to safely restrain a cat's head if you're not scruffing it. I don't usually resort immediately to scruffing because it does tend to escalate the stress. If we really had to work with him and I had to have his whole body out so I couldn't wrap him in a towel, you can this is scruffing. It's what mama does to the babies, and in some cats it calms them down, and actually he has stopped moving since I've done that. But it is helping to restrain him, and you can restrain cats for procedures this way, and I may ask you to do it especially if he's trying to bite. If he's trying to bite and there's something I absolutely have to do to him, if you do this, you can control his head. But yes, some of this restraint here, I probably won't have you do, but we do this a lot in the vet clinic, and it doesn't hurt him, and in a lot of cats, it puts them into sort of the state that they were in when mama did this, because mama would carry the babies around like this. Well, she wouldn't grab your back feet, but some cats, it really freaks them out and they get a lot worse. So I don't like to do this unless I have to do it. So if we're going to be working with him and I need to work with different body parts, but I don't have to have the whole cat out, you can make a kitty burrito. And just to keep the sharp claws from getting me or you.
The boring mode.
What we do is we put the cat on top of the towel with the long bits on either side of the cat, and we just wrap the towel around the cat. In some cats, this will actually have a calming effect for them, but it allows me to have access to his bottom, so I can take his temperature. I can pull one leg out at a time without having to worry about getting clawed by the other legs. It actually, if you hold on to it here, it helps keep him from biting. I actually usually like to hold on to it near the back of the neck, because then he's less likely to bite, me, the person restraining. And if he was really upset, he could get out of this. The other thing that you can do sometimes to calm them down is to actually cover their heads. And it does, like with a hawk, it does help calm them down. The kitty burritos are very handy, and for that cat that isn't going to let you scruff him, putting him in a kitty burrito is a good way to, and then I can take out a leg and look at it. That's mostly the thing with cats. I don't want them leaving while I'm doing the exam. I don't want them jumping down and exploring the room. The thing about cats is that they can get into little tiny spaces, and they will, and they will explore until they find what they consider to be an out, and they'll go in there, and then we'll have a cat somewhere in the ductwork of the building, and that's going to be a big problem. So. Decision, but generally what happens is if the animal scratches or bites you, then the animal gets quarantined for 10 days. The incubation period for rabies is so long that you during those 10 days wouldn't have to worry.
Right.
If during those 10 days the animal shows signs of rabies or dies,
Yeah.
then the animal gets tested for rabies. If it's alive, it gets euthanized and tested for rabies, because we test them by taking a piece of their brain.
Yeah.
So they get tested for rabies, and then if they're negative, you don't have to worry about it. If they're positive,
Right.
then you get the post-exposure.
I-
Now, if the dog isn't available or the cat isn't available, you know, say you get bitten or scratched and the cat shoots out the door and we never see it again,
Right.
then we call the state and you may need to get post-exposure.
Yeah. Okay.
But yeah, the animal's available for us to quarantine. That's why if you've ever heard of the animal control officer being like, oh, your dog bit somebody, we have to quarantine it for 10 days. It's
Right.
not a punishment. We
Right.
just want to make sure that that animal wasn't contagious for rabies during the 10-day time after they bit somebody.
Okay.
Because at that point, the incubation period, if they show signs, then they were contagious, and then we have to worry about the person that got bitten or scratched.
I